Hey Shark fans, it's Melinda Marsalis. Welcome to Heard It on the Shark. Heard It on the Shark is a weekly interview show that airs every Tuesday at 11 a.m. on the Shark 102.3 FM radio station based in Ripley, Mississippi. Then it's released as a podcast on all the major podcast platforms. You'll hear interviews with the movers and shakers in North Mississippi who are making things happen. I'll talk to entrepreneurs, leaders of business, medicine, education, and the people behind all the amazing things happening in North Mississippi. When people ask you, how did you know about that? You'll say, I heard it on the Shark. Musical credit belongs to Hill Country Blues guitar legend Gary Burnside and the late great Buddy Grisham, playing Long Way Home from their album Acoustic Brothers, which was recorded at Sun Bear Studio in Ripley, Mississippi.
This program was recorded at Sun Bear Studio in Ripley, Mississippi.
Hey Shark fans, it's Melinda with another episode of Heard It on the Shark. And today in Sun Bear Studio, I have with me Miss Bailey McNeese, who is a nurse practitioner at Family Care Clinic of Ripley. Bailey, thanks so much for coming in.
Thanks for having me.
We are doing a nurses series, and you are nurse number 2. Last week, we heard from Dana Murphy, who is the chief nursing officer over in Corinth. And today, we're hearing from a nurse practitioner who works in a care clinic that is built for families. Way different, right?
Right. Very different.
All right, let's talk about that. So in a big old hospital, I'm sure that a nurse is, I say pigeonholed, I don't mean that in a negative way, like you are working in a specialty area, like pediatrics or geriatrics or the ER. You might be pediatrics for 15 minutes, geriatrics the next, and emergency room the next.
That's true. In primary care, we see a little bit of everything. You never know what it's going to be from one day to the next. So we see it all.
Okay, well, let's talk about how did you get to this point? What was your career path and your education path?
Okay, I've been a nurse for 15 years, and 10 of those have been as a nurse practitioner. So I graduated from Mississippi University for Women with my Bachelor's of Science in Nursing. And while I was working as an RN, I worked in a variety of backgrounds, mostly adult ICU and pediatric cardiac ICU, but also in the outpatient clinic and hospice briefly. And I got my Master of Science in Nursing from UAB in Birmingham. And the past 10 years, my experience as a nurse practitioner has been all in primary care.
Okay. And so is there a difference in it? I know there is, but I don't know what it is. Is there a difference in an RN and a nurse practitioner?
Yes. So an RN is your frontline nurse. They're the ones coordinating your care, giving medicines, monitoring you, and making sure everything runs smoothly day to day. A nurse practitioner is an advanced practice nurse. So we've gone through additional graduate level training so that we can diagnose conditions, we can order tests, perform some procedures, and prescribe medications. So both are nurses, but nurse practitioners have a higher level of training and a more broad scope of practice.
This is what I love about y'all, because I'll just say this is my care clinic. This is where I go when I need something. And so what I love about you, particularly, and Wanda, is that you've seen me every other time I've come in for any other thing that's wrong with me. And so if there's a story to stitched together that maybe something's happening with me that I wouldn't recognize, you might recognize it because you've seen me every time. And I like that you're the through line to my health, and you may notice things that I would not notice.
So our clinic is considered a patient-centered medical home. So a lot of people don't know what that term means, but it's called patient-centered because the focus is on you as a whole person, not just a single problem you might have. And medical home just means it's, like you said, your home base for healthcare. We try to keep everything organized instead of bouncing between different providers and they're trying to piece together your history or piece together things about you. We have one main care team. We know you. We keep track of your history. We coordinate everything you might need, like referrals, follow-ups, your medicines, all of it.
Okay, and so you said referrals. Let's talk about that. So there will come a time, I mean, I'm a fairly healthy person, but if something major procedure were to go wrong with me, you would refer me on to a specialist.
That's correct. So we do all that we can within our scope of practice. And if there's ever a time when you needed a higher level of care, or like from a specialist or a different test or procedure that we couldn't do, our goal as primary care is to identify who you need to go to, who's going to give you the best care and get you where you need to be so you can get the appropriate care that you need.
Do you keep up with, like, if I've gone to a specialist, do you get those records back?
Yes, we try to have all of your medical records on hand so that we can be up to date on your most current treatment plan, any medication changes that were made, any tests or procedures that were done.
Tell me some things that Family Care Clinic does that we may not know about.
Okay, at our clinic, we do everything. So we see babies for well checkups and immunizations. We can do x-rays. We can suture your lacerations. We do DOT physicals, sports physicals. We do all those things on top of managing chronic conditions like high blood pressure and diabetes. We see everything, all ages.
Okay, here's a random question. What's your favorite sort of patient to come through the door? What do you like to do most?
Oh, that's a really hard one for me because I love all ages. I love pediatric care, but I also love adults, geriatric. I love it all. So it would be hard for me to narrow it down.
As a nurse, if there's people out there listening and they're thinking about their career in medicine, maybe that's a thing you need to think about. Do you like to mix it up all day long and have a different, you never know who's coming in the door next? Or do you want to know every day I'm going to be taking care of hip replacement or feet or whatever it is that you decide to specialize in? Is that important to think about?
Yes. So that's one of the beautiful things about nursing is that there's a lot of flexibility in your career options, and there are a lot of paths you can take. So you could work as an RN and stay at the bedside. You could branch into specialty things like pediatrics, like ICU. You could even do nursing education. If you wanted to, you could go back to school like I did, nurse practitioner school. And so you could even branch out into a variety of specialties there. You could stay in primary care or branch out into another specialty as a nurse practitioner. So that's the flexible career. That's one of the biggest strengths of the field of nursing, I think, is the flexibility and the variety that you can see over your career.
I know that the next series that we're going to do this summer is about career coaches and helping kids to know, teenagers to find out as they're in high school what it is they might be interested in doing. Would you recommend a vocational class in high school or a shadow day, an internship, or maybe just go get your LPN and see if you like that? What do you recommend?
So for high schoolers who are considering a career in the medical field or for nursing, I would say get all of the exposure you can. I would say do a vocational class, try to shadow, volunteer every opportunity you can to see what healthcare really looks like, because nursing in real life is very fast-paced. It's demanding. It's messier than it looks from the outside, but it is such a rewarding career. You're there with people on their best days, on their worst days. It's a privilege to care for your community, your neighbors, and it's a privilege to use your talent and training to care for your neighbors.
Can you get too old? Can it be a midlife career change? Like maybe you're 40 and you want to make a change and go back to school. Do you ever see people do that?
Absolutely. I see people all the time who are considering going into the healthcare field, and I would say give nursing your consideration because it's a beautiful career. It's wonderful, and I have loved it.
Does anything throw you off your game? Like, does anything ever happen that you're like, oh, no?
I should say primary care keeps you on your toes. You have to know a lot about a lot of different things. You never know what's going to come in the door. But that's one thing I really like about primary care is because it's something a little bit different every day.
That's awesome. Bailey, thank you so much. Thanks for being at Family Care Clinic of Ripley and for dedicating your life to helping the community here. And thanks for being a nurse and sharing your information with us today.
Thanks for having me.
Okay, Shark fans, that's it for this edition of Heard It on the Shark. Tune in every Tuesday at 11 a.m. to find out what's going on from other local community leaders like Bailey. If you have a question, comment, or suggestion for an interview, or if you want access to this interview, you can go to our website, shark1023.com, and click on the podcast tab. Keep it tuned to the Shark 1023 and have a great rest of the day. This show is made possible by JC Media, LLC in Ripley, Mississippi. JC Media owns the Shark 102.3 Classic Rock FM radio station where the show is hosted. Subscribe to our podcast on your favorite app or stream episodes online at shark1023.com/podcasts. We also have an email in which you can share your feedback. That email is theshark1023@gmail.com.